in Bears Lake. I want to commend the bikers, all of them, for taking on this daunting task. It's a bit hard to imagine biking that far for those of us who bike for half an hour in our family rooms and think we've accomplished something great. The money raised will go to support patients battling leukemia and lymphoma and will help purchase endobronchial ultrasound, or EBUS, scope technology for the QE2. EBUS technology will provide improved imaging, and patients won't need invasive surgery for the procedure, a huge improvement. I'd like to particularly commend the top fundraisers, the team from Clearwater, led by CEO Ian Smith. They raised over $83,000 because their donations were matched by the company. Kudos to them and to Clearwater for stepping up.
Thank everybody for those member statements. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Yesterday, the Liberal Party began advertising to try and explain away its complete mismanagement of its impasse with teachers. Mr. Speaker, in that ad, the government says directly, or the Liberal Party does, that they want to work with teachers. Well, now teachers have asked for mediation. I would like to ask the Premier, is he agreeable to sitting down at the table and mediating his dispute away with teachers?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable Member for the question. Mr. Speaker, we were prepared to sit down at the Conciliation Board. What we said to teachers, Mr. Speaker, we have what we believe is a fair offer on the table. If they have other ways of finding savings that they want to use towards keeping a long service award but provide those savings back to the taxpayers of Nova Scotia, we're prepared to have that conversation.
The Honourable Leader of the Official Opposition.
Mr. Speaker, teachers asked the Minister of Labour for conciliation. She never heard back from the government. That's why there's no conciliation. Now they're asking for mediation, Mr. Speaker, and rather than agreeing to that, the Premier gives his usual stock answer, which leaves everyone wondering, parents, students, the whole province wondering why they won't go back to the table. I don't know what they're afraid of, Mr. Speaker, at the negotiating table, but I tell you this. When you advertise that you want to work with teachers and you frustrate every effort that teachers are making, that parents are hoping for, to actually work with them, that is false advertising, Mr. Speaker. It is wrong. Why is the Premier advertising one thing and doing the opposite?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable Member for his question. We've continued to work with teachers across this province. Mr. Speaker, they've made legitimate issues around data collection, other things that are happening inside their classroom. We're reaching out, talking to those teachers, working with them to find solutions. From the very first time in October 13th, we've invested in classrooms, Mr. Speaker. We've capped class sizes, hired more math and literacy teachers, Mr. Speaker, hired more teachers in general, Mr. Speaker, continue to invest in the classroom. What I have said, and if the Honourable Member would follow, go back and look at what's happened in the collective agreement, there were two different times when our government reached a collective agreement with the union leadership, Mr. Speaker. Their membership said no. The last time, Mr. Speaker, we actually accepted what the union brought to the table, Mr. Speaker. If they want to change their mind, Mr. Speaker, what are they going to bring to the taxpayers of Nova Scotia to offset the increases they want?
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, the place to work that out is actually a negotiating table. He's asking you, Mr. Speaker, and us in this House, what do they have to put on the table? He should be going to the negotiating table, a conciliation board, a mediator, and asking them, Mr. Speaker. All of us agree there needs to be classroom improvements. The government agrees. The opposition agrees. Teachers agree. Parents are speaking up in frustration because they agree. Why won't he go and talk to teachers at a negotiating table with a mediator and work out these very differences?
The Honourable Premier.
Mr. Speaker, the Honourable Member should know that's exactly what we said. It's exactly what we said we would do. We would go to the Conciliation Board to have the conversation about that, Mr. Speaker. The teachers' union said no, Mr. Speaker. They don't want to go, Mr. Speaker, and bring to the table savings to taxpayers. They don't want to say that they should pay 35% of their health benefits like every other public servant. They want to continue to accumulate 195 sick days, Mr. Speaker. At the same time, Mr. Speaker, they want every other taxpayer to contribute to a bonus when they retire, Mr. Speaker. Mr. Speaker, at the same time, they want us to invest in the classroom. Here's what happened, Mr. Speaker. 3 years ago, that party chose to give a 7.5% pay raise, take $65 million away from students, Mr. Speaker. We've chosen another path, 3.5% pay raise, and invest in classrooms.
The Honourable Leader in the House for the New Democratic Party.
Thank you very much, Mr. Speaker. My question is to the Premier. Mr. Speaker, our caucus has asked the Minister of Health for details about the government's cut to long-term care 6 times on the floor of this legislature. We filed a Freedom of Information request. We wrote a letter to the Minister. We requested a review by the Office of the Information of Privacy Commission. Yesterday, we asked the Minister for the 7th time he finally would table documents showing the extent of the cuts of long-term care. Is this really what it takes to get information from this government? Mr. Speaker, will the Premier apologize for his ministers failing to provide members of this House with accurate information about long-term care cuts?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. It gives me an opportunity to thank the Minister of Health for the work he's been doing across our province. Mr. Speaker, continuing to collaborate with our partners, Mr. Speaker, continue to make sure that we provide health care in communities across our province. Mr. Speaker, the amalgamation of a district health authority into one authority is allowing us now to look across our province to deliver health care services.
Order, please. The Honourable Premier has the floor.
Mr. Speaker, I want to again thank the Minister of Health for the work that he's doing, the collaboration that he's been doing across the province. The fact that we've amalgamated into one single health authority now has allowed Nova Scotians to have access, Mr. Speaker, to a unified health care system.
The Honourable Leader in the House for the New Democratic Party.
Thank you. Mr. Speaker, over 2 years this government has cut more than $200,000 from the budget from St. Vincent's Nursing Home. They have cut more than $150,000 from Oakwood Terrace. In total, over 2 years, more than $8 million was cut from the budgets of nursing homes and residential care facilities. More than $6 million of that came out of budgets of non-profit facilities. Mr. Speaker, does this Premier still think it's reasonable to ask non-profit nursing homes to provide care for seniors with a $6 million less in their budgets?
The Honourable Premier.
Mr. Speaker, I want to thank nursing homes across the province, Mr. Speaker, caring for our parents. There were four administrators here a couple of weeks ago, Mr. Speaker, who said that the changes to their budgets have not affected quality of food, has not affected delivery of service, Mr. Speaker. They did raise the issue that on an ongoing basis they may have some challenges. The Minister of Health has reached out to continue to work with them to make sure that the quality of care that we all expect to be there, and we're going to continue to do so. And again, Mr. Speaker, I think we should all be proud of the work that many of our colleagues are doing across this province to care for our seniors.
The Honourable Leader in the House for the New Democratic Party on his final supplementary.
Mr. Speaker, these cuts were made in the spring, and the Minister waited until October to reach out to these facilities to ask if they are having any challenges. This government has only one idea: cut. Cut services, cut benefits, cut programs, and cut budgets. There are no rationality for these cuts, and there has been no understanding of the possible impact on these cuts on seniors living in long-term care. Mr. Speaker, will the Premier agree to restore funding to long care facilities across our province?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. It couldn't be further from the truth, Mr. Speaker. We have on the table an increase in salaries across the entire public sector, Mr. Speaker. We have $59 million that we're spending more on home care than that government did, Mr. Speaker. On top of that, Mr. Speaker, we're spending $65 million more in classrooms across this province, Mr. Speaker, that government cut out. Mr. Speaker, this isn't a government that's cutting, Mr. Speaker. This is a government that is moving forward in partnership to make sure we have sustainable services in this province that Nova Scotians have come to expect.
The Honourable Leader for the Official Opposition.
Mr. Speaker, last spring, Nova Scotia taxpayers paid all the bills in the City of Portland to upgrade their ferry terminal, to paint the lines in the parking lot, and so on, Mr. Speaker. Now we know from Portland that they collected $85,000 in fees from the Yarmouth Ferry. Mr. Speaker, they got the gold mine, we got the shaft. Will the Premier explain to the taxpayers of Nova Scotia why it's fair that Portland collects the money and we get the bills?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question, and I want to thank all of those citizens across our province who have made sure that this year was a boom year, Mr. Speaker, in tourism. Mr. Speaker, while the Honourable Member stands up time after time after time being pessimistic about this province, Nova Scotians are optimistic, and we're going to stand with Nova Scotians, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, I think the Premier needs a math mentor, not just the students, because the ferry traffic was down this year, even though the cost is going up. Mr. Speaker, that's the problem. In fact, we now know from the Portland Herald that Bay Ferries intends to ask our taxpayers for $10 to $12 million next year to continue to subsidize the ferry, Mr. Speaker. They told us, the government did, it would be 9. Now it's 10 to 12, Mr. Speaker. First of all, we're hearing it from Portland and not from our own government. And secondly, it's going to cost 30% more. So I'd like to ask the Premier why we have to find out from Portland, and has he been given a budget that shows we owe 30% more next year to Bay Ferries?
The Honourable Premier.
Mr. Speaker, again, like every time the member stands up, he's inaccurate, Mr. Speaker. He goes on and on and goes on, and because he makes it up on the fly, Mr. Speaker, doesn't make it true. The reality is, Mr. Speaker, and Mr. Speaker, the Honourable
Order, please.
Mr. Speaker.
Order, please. The Honourable Premier has the floor.
Mr. Speaker, the honourable member suggested I could use a math mentor. Mr. Speaker, I could use all the help, Mr. Speaker, I could get. Unlike the honourable member, I don't believe I have all the answers, Mr. Speaker.
Just like to remind the Honourable Leader of the Official Opposition before we proceed that indicating that taxpayers getting the shaft is unparliamentary. The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question today is for the Premier. Yesterday, the Nova Scotia Teachers Union asked the Labour Minister to appoint a mediator. Unfortunately, however, it seems the Premier only wants to talk about contracts and benefits if it's in front of a camera. He even went so far as to say, do teachers want him to cut health care funds from the most vulnerable Nova Scotians to cover their wages? But wait, after all of his cuts to seniors' long-term care facilities, it seems the Premier has already done this. So, my question, Mr. Speaker, for the Premier, will the Premier please stop wasting time and money on rhetoric and partisan ads and agree to mediation with the NSTU as the teachers have requested?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. At every step she's wrong, Mr. Speaker. We put $59 million in home care to invest in seniors across this province. We'll continue to do so. Mr. Speaker, we've invested in housing for seniors, Mr. Speaker, and unlike that party, we've invested in classrooms and kids. When she was sitting on this side of the House, Mr. Speaker, she sat on her hands. She sat on her hands when she took $65 million away from kids.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, you know, I think anybody who knows me knows I have never sat on my hands, and I don't think I would ever be able to. Mr. Speaker, yesterday a group called the Nova Scotia Parents for Teachers held a press conference right here in Province House. This group yesterday had 400 members online. Today they have close to 3,000. An online poll by Metro News with more than 4,000 votes found 87% of people support teachers. It seems everybody but the Premier understands that, in fact, the classroom of 2016 is not the classroom of yesterday. And my question for the Premier is the Premier now willing, instead of running partisan ads, is he willing to listen to Nova Scotians and get back to the bargaining table with the Nova Scotia Teachers Union?
The Honourable Premier.
Speaker, I want to thank the honourable member. I want to remind her, Mr. Speaker, the ad that she's seeing is paid for by the Liberal Party, unlike when she was in power and the government was paying for the ads, Mr. Speaker. You remember the slogans, Mr. Speaker. You remember the slogans. Furthermore, Mr. Speaker, we stand with teachers as well. We believe in teachers and what they're doing across this province, Mr. Speaker. It's why we put $65 million in the classroom. And she's absolutely right, Mr. Speaker. It isn't the classroom of yesteryears, Mr. Speaker, because it's been devastated by that party when they were in power.
The Honourable Leader of the Official Opposition. Order, please. Order, please. The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, now we know where the Richmond taxpayers' money went when in the Liberal Party account it went to pay for Liberal Party ads. That's a good use of their money, I guess, Mr. Speaker. We also know that George Armoyan and his family, the owner of Scotia Learning, gave $19,000 to members of the Liberal Party who were running in the last election, $12,000 to 5 cabinet ministers. We asked yesterday why those 5 ministers were in cabinet when discussions around the decision to buy those schools owned by Scotia Learning was made. Premier said it never went to cabinet. Mr. Speaker, I have the order in council here where it did in fact go to cabinet. I'll table that. I know the Premier cleaned this up at the media yesterday, but the question remains, why did he allow those 5 members who are in a clear conflict of interest to stay in the cabinet room when million-dollar decisions were being made?
The Honourable Premier.
Speaker, they weren't in a conflict of interest, Mr. Speaker. The Honourable Member would know the amount of dollars that were on the cabinet table were decided in the 1990s, Mr. Speaker. The amount to buy those schools were delivered in the original contracts. We exercised our right, Mr. Speaker, because we believe it was in the best interest of taxpayers.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the Cabinet decided to spend $86 million. It had options. It may even have made the best option. We don't know. I wish we could see their math, but I'll tell you this, Mr. Speaker, it is a conflict, and the province's own conflict of interest policy is very clear on that, where it says a conflict exists when the duties and responsibilities of an employee are or potentially could be compromised by his or her personal and private interests. Mr. Speaker, there were 5 cabinet ministers in the room when this $86 million decision was being made who are in receipt of $4,000, $3,000, $2,000, another $2,000 each, Mr. Speaker. In the case of the Liberal caucus chair, 3/4 of his campaign was funded by the Armoyans, Mr. Speaker. How can the Premier say there is no conflict when that much money was donated to members of the Liberal Party?
The Honourable Premier.
Thank you, Mr. Speaker. Again, I want to remind the honourable member that the purchase price of those schools was negotiated in the original contracts. Mr. Speaker, there was an exercise clause in there that by October 31st, the government had to exercise its right to purchase those schools. The Department of Education could not negotiate a better lease arrangement than what we could get from the value of that. If that changes, Mr. Speaker, we will lease those schools, but we exercised our right because it was the best value for taxpayers. At the same time, Mr. Speaker, we wanted to be able to send a message to those 12 communities that those schools would be there for the long haul for their children.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. And I tried to get this question in yesterday, but was unable to. So, to the Minister of Health, the other day in debate on the NDP's Fair Drug Pricing Act, the Minister spoke about the success of their hepatitis C program. Patients who would eventually die of liver disease now have the hope in the form of a cure. And a new biologics called Solved or Harvoni. So my question to the Minister, can he give us an idea on the number of Nova Scotians with Hep C and how many are receiving Harvoni?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and the member opposite saves those very important questions for the last 30 seconds of question period, but I appreciate that he brought it back on the table today. There are currently 347 Nova Scotians with Hep C. Some are receiving treatment through their private insurance programs, and we're there as a government to look after those who do not have such programs.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. I mean, we are concerned at how the program is being rolled out and how the cure is being rolled out. Never mind program, the cure for hepatitis C. The program is very restrictive on who can get the cure. And I know the cost of the drug can range from $55,000 to $80,000 for an 8 to 24-week treatment. And that's expensive, but if we can eradicate this virus across all socioeconomic populations, the savings on treating liver disease will be huge, not to mention that it's our duty to help people who need our help. So my question to the Minister is, will the Minister adopt a true eradication plan to ensure that no more Nova Scotians need to suffer from this virus?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I would inform the member that it's always a clinical decision between the patient and the doctor as to what course of treatment they receive and when they receive it, and he is very right that can be great savings, certainly to the lives of those impacted by Hep C, as well as the cost to the healthcare system. But I guess it's a time to remind all Nova Scotians that prevention indeed is the best measure that can be taken when it comes to hepatitis C. And currently, the Nova Scotia Health Authority is looking at that comprehensive program, especially in relation now to the opioid panel that has been put together, and certainly safe needle exchange is part of that program.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, my question is for the Premier. This week, this government announced that it would start the process of buying P3 schools that should have been built and owned by the public in the first place. It is going to cost $87 million, and that is just the first round. Let me be clear. This is the cost of cleaning up a big mess that the Liberals made going into P3 schools 20 years ago. Mr. Speaker, will the Premier pledge to abandon P3s in the future so Nova Scotians won't be faced with the cost of cleaning up another Liberal P3 mess 20 years from now?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. As he knows, any challenges in governing, you have to make difficult decisions. Well, wait a minute, they didn't make any difficult decisions. But typically, governments have to make difficult decisions, Mr. Speaker. We look at all of the options that are before us. We look at all of the options before us, Mr. Speaker, just like their government did when they signed the P3 agreement up the hill.
The Honourable Leader in the House for the New Democratic Party.
Thank you, Mr. Speaker. Well, I'm not very surprised that the Premier has not learned his lesson. Yet I'd like to remind him that the other terrible P3 president is the Highway 104 Cobequid Pass. The private owners of the P3 have been making money hand over fist for years, Mr. Speaker. And just this year, the government tried to suggest more highways be built by this P3 model. So, Mr. Speaker, will the Premier tell Nova Scotians why is he so attached to P3s? Are there any benefits for the public, or are the benefits just for the particular friends of the Liberal Party donors who get the large contracts?
The Honourable Premier.
Mr. Speaker, the allegations put out by the member is just simply false. But I will tell you, Mr. Speaker, who's benefiting from that highway. Those families, Mr. Speaker. That was brought to a government, Mr. Speaker, with hundreds of thousands, Mr. Speaker, when tens to 20 to 30 to 40 people were being killed on that highway, Mr. Speaker. It was being named as Death Highway, Mr. Speaker. How many lives is that member prepared to put at risk? It's why we're looking at Mr. Tolling highways. He's had a fire chief, Mr. Speaker, from Barney's River, who said, I've gone to too many wrecks on the highways and have to go to too many families to tell them that they've lost a loved one, Mr. Speaker. We're looking to see how quickly, Mr. Speaker.
Order, please. The Honourable Premier has the floor.
The member from Pictou East, I hope he stands up and defends his community. He stands in this House all the time, Mr. Speaker. He sure does, Mr. Speaker. He runs when he has to do something. But I want to tell the Honourable member, Mr. Speaker, we're going to make sure...
please.
We're going to make sure we have safe highways.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. It wasn't long ago that I stood with the current Minister of Health on the Hollis Street steps in front of a forestry rally that was opposing the NDP's lack of action on reducing clear-cutting, ending whole tree harvesting, and setting targets for cutting in the province. On that day, the now Minister of Health said, quote, we must have an annual allowable harvest on Crown lands in Nova Scotia because right now they are not the golden standard that the Crown lands should be. Mr. Speaker, the Minister of Natural Resources just recently issued a report that says the department has no plans to implement a province-wide allowable cut. So, Mr. Speaker, why does the Minister of Natural Resources disagree with his colleague who says that an annual allowable harvest is needed and without it, Crown lands don't meet a gold standard?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the member opposite for the question. A careful review of our 5-year look at the natural resource strategy reveals that we are fully intended and going down the direction of implementing all the 93 recommendations that came from that process, Mr. Speaker. In terms of the total annual cut, that's a very, very scientifically engineered process. We're in complete control of what is being cut. We know the species, we know the locations, and remember, Mr. Speaker, that 70% of the land that's being harvested in Nova Scotia is private land, but on the Crown lands, I can assure the House that we're in full control of what we're doing. Thank you.
The honourable member for Dartmouth East.
Mr. Speaker, the minister seems to be saying something very different than what was in his own update just a few months ago. The minister's colleague at the time also lobbied for things like larger riparian zones in the same speech, and he spoke about clear-cutting targets. And just a month before the 2013 election, he wrote in a newspaper, the goal of reducing clear-cutting by 50% of total harvest remains as elusive today as when the government made the promise 4 years ago. I see the Minister of Health laughing. I'm sure he likes the quotes. But, Mr. Speaker, that same comment could be made today. And in the minister's natural resources strategy update, he's walked away from the clear-cutting targets, refused to create a whole tree harvesting rules, and says there is no plan for the allowable cut. So, Mr. Speaker, why has the minister walked away from the long-time Liberal Party policy and his cabinet colleagues' own commitments and bills he's introduced over many years?
The Honourable Minister of Natural Resources.
Mr. Speaker, forestry is not just about numbers, Mr. Speaker. It's more about getting the best value from the land while maintaining a healthy ecosystem and a sustainable supply of wood. Emphasis on the healthy ecosystem. And this goes way beyond the simple arbitrary assignment of an arbitrary target. All aspects of biodiversity are being considered and taken into account using a science-based approach to produce the greatest yield for the greatest number of people in the province of Nova Scotia. Thank you, Mr. Speaker.
The honourable member for Inverness.
Mr. Speaker, a question for the Minister of Health. Mr. Speaker, for over 100 years we've had surgery at the hospital in Inverness. Mr. Speaker, we have a physician that's expected to retire, a surgeon expected to retire in December, and another one not too far behind. I also think, Mr. Speaker, about the economic activity this means for Inverness. With a surgeon and 6 nurses and an administrative person, there's probably about $1 million in payroll that's coming into the area. So, Mr. Speaker, is there a plan in place through the Department of Health and through the Health Authority to ensure that surgery continues in Inverness?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I thank the member for raising that question. I know that the Health Authority sometimes will run into trouble in terms of recruitment. As we now know, right across this country, confirmed recently at the Accord meetings, that every minister is up against the wall in terms of recruitment. There just are not enough doctors in some categories and areas available right across Canada, and I know recruitment is certainly underway.
The honourable member for Inverness.
Mr. Speaker, I also want to take the opportunity just to highlight the point that Inverness, while it's not a regional hospital, it is 2 hours away from the closest regional hospital, be it in Sydney or Antigonish. And I'm hopeful that I know the minister is aware of that, and I know he understands the importance of having services that are still available to people when they're living that far away from a regional hospital. Mr. Speaker, I think about the convenience for local patients, less travel for their families when they're going to see loved ones who may have just had an operation. If they don't have to travel to a regional hospital, that means a lot to them. I also think about possible delays and what that could mean for the health of patients who need an operation. So, Mr. Speaker, if surgeons are not replaced, will this actually save money, or are we going to lose an important health care service in Inverness?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I certainly will find out for the member opposite what the health services plan is for Inverness Hospital. I know the great work that has been done there through the years, and having again, I guess, in that particular geography, certainly an array of services is very, very important to that part of the province, and I will provide the member with an update next week.
The honourable member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Premier. Mr. Speaker, we learned yesterday the McNeil government is launching a public relations campaign rather than talking with teachers and working out their differences. The Premier said a second government-funded ad campaign is on its way, something he used to criticize the NDP for doing. My question to the Premier, why is the Premier using government money in a PR campaign rather than returning to the table?
The Honourable Premier.
Speaker, again, I want to thank the honourable member for the question. As he would know, his party exercised their right to put an ad on TV a few months ago, Mr. Speaker. We as a party have exercised our right to spend the money to invest in an ad for TV, Mr. Speaker, and as I said, as a government, we will communicate with Nova Scotians when necessary, but we have not used any government money to go in a campaign against education or teachers, Mr. Speaker.
The honourable member for Pictou Centre.
Mr. Speaker, we saw this with the seniors' pharmacare. The Premier moved forward with a decision to raise seniors' premiums until it became so unpopular that it was impacting his public image. Then he launched a 17,000 PR campaign using money to do damage control. My question to the Premier, how much taxpayers' money is the Premier willing to spend to do damage control this time?
The Honourable Premier.
Speaker, I want to thank the honourable member for the question. Mr. Speaker, as I travel this province, Mr. Speaker, Nova Scotians are grateful that they have a government that is not only investing in programs, Mr. Speaker, not only investing in classrooms, Mr. Speaker, not only investing in wait times, at the same time living within its fiscal means, Mr. Speaker. I hear the honourable member's leader stand up in the House. I hear the honourable member stand up. Where would they find the money, Mr. Speaker? Where would they take it from in order to give the kind of increases they would think they should give?
The honourable member for Halifax Needham.
Mr. Speaker, through you for the Minister of Community Services, there is a desperate need for more and better quality affordable housing units. Many residents living on social assistance live in horrendous conditions with bed bugs, mice and cockroaches. Recently, media reported on a building that did not have working plumbing in many units and required tenants to use the facilities in unoccupied units on other floors. So I asked the Minister of Community Services, if the government is paying rent to private landlords, do they not have an obligation to ensure that social assistance recipients are not living in inhumane conditions?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker, and I appreciate the question. When a rent supplement is supplied to a private developer, our Housing Nova Scotia staff goes in, carefully vets that building, carefully vets the history of the building, and then keeps an eye on it during the course of the longevity of the rent supplement. I believe the building you are speaking of is a private landowner, which I have absolutely no jurisdiction over, but the HRM bylaws, and I see over the last couple of months that they've actually been enforcing them, have been moving in on landlords to demand that they have a quality of standard for their buildings in HRM particularly.
The honourable member for Halifax Needham.
Mr. Speaker, of course, not all people on income assistance who need to rent in the private sector are able to access rent supplements, and I'm worried that residents on social assistance are afraid to complain about their living conditions because there are very few affordable units available on the private rental market, and if they withhold their rent to protest poor conditions, the policy of the Department of Community Services is that they will withhold that portion of their income assistance check. So I asked the Minister, what is her department doing to address the problem of untenable living conditions in the affordable private sector rental market?
The Honourable Minister of Community Services.
Thank you. Unfortunately, it is not under my jurisdiction to ensure that a private developer or a private landlord maintain the quality of living in their privately owned buildings. But I can assure the member that when there are rent supplements that are paid for by the Department of Housing of Nova Scotia, that we carefully vet those units. We work with those landlords. Though we have a great relationship with many landlords in this jurisdiction in HRM, and we make sure that where our clients are living is clean, safe, and affordable through those rent supplements.
The Honourable Leader of the Official Opposition.
Mr. Speaker, I would like to share with the Minister of Health the posted closure hours for the emergency room at All Saints Hospital in Spring Hill for this week. Monday was 8 a.m. to 8 p.m., Wednesday 8 a.m. to 8 p.m., Thursday 8 a.m. to 8 p.m., Friday 8 a.m. to 8 p.m., Saturday 8 a.m. to 8 p.m., Sunday 8 a.m. to 8 p.m. Mr. Speaker, this is an unacceptable level of service to the people of Spring Hill and the area. They were certainly promised much more by this government and the previous NDP government for the emergency services there. I would like to ask the Minister of Health again, will he provide a locum doctor immediately to these people of Spring Hill so that their emergency room can be open?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I thank the member for bringing the question back to the floor of the legislature. It is unfortunate. It is unfortunate that one of the local doctors is out sick for the month of November. And in talking with Dr. Lynn Harrigan and the Health Authority, they are working as quickly as possible to provide a locum. I think there's about $8 to $10 million in the budget for locum, and they are working as quickly as possible to provide for the remainder of November a locum physician.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, I appreciate that, and I hope that we see that doctor immediately because, Mr. Speaker, the closures anticipated for November are 27 days. 27 out of 30 days, the emergency room in Spring Hill is going to be closed, open 3 days. The minister wants to say that this is because of a doctor illness. Well, 3 doctors have left Spring Hill, Mr. Speaker, with lots of notice. It's not like the health authority suddenly today had this problem. They have known for months that they were short doctors. So I would like to ask the Minister of Health to tell the people of Spring Hill now when they will see this locum doctor, and what are they doing to recruit permanent doctors to Spring Hill?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And what I can tell the member is that they are working as quickly as possible to provide a locum for the area. And we know that in some communities, the number of doctors are right at that threshold of when one is sick or decides to take professional development. There is a gap for sure. So the Health Authority, as I said, is working as quickly as possible. In the long term, the member opposite will have to wait a little while to find out how successful our recruitment is going.
The Honourable Member for Kings North.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Education. Mr. Speaker, on December 23, 2013, just 2 days before Christmas, this government announced the construction of 5 schools in Liberal constituencies without any due process or public consultation, and I will table that. It was a political reward, a Christmas gift for voting Liberal for the ridings of the Premier, the Minister of Education, the Minister of Municipal Affairs, and the Minister of Natural Resources. I heard the Minister of Education say yesterday in this legislature that school board decisions were final. I guess that only applies if it's not a Liberal cabinet minister's school. Mr. Speaker, my question is, will the minister tell this Assembly and the people of Nova Scotia why there is one set of rules for themselves and another set of rules for the rest of the province?
The Honourable Minister of Education.
Thank you, Mr. Speaker, and I'm really pleased that the member has raised the question. And if he was really following the process, he would understand that the schools that were announced each year, whenever they're announced, are schools that boards have identified based on a request to school boards about what capital projects, whether they're new or whether they're renovations, that they see as a need. And from that list, year after year, some of those get approved. And the ones that he's speaking of in particular were submitted by the boards long before we formed government.
The Honourable Member for Kings North.
I'd like to thank the Minister for that answer. I will redirect, Mr. Speaker, to the Premier. The December 23rd announcement of 2013 also applied to Bridgetown. The AVR-SB plan for Bridgetown was for renovations to the Bridgetown High School and the Bridgetown Regional Elementary School in 2014-2015, and I will table that plan. Also, the AVR-SB has a policy that it does not wish to have, the policy is they do not want elementary, middle school and senior schools combined if possible, which is what happened. I'll also table that. A Christmas gift for cabinet ministers, ignoring the standing policy of the AVRSP. Bridgetown is happy, But, Mr. Speaker, my question, what does the Premier say to the other areas of the province losing their schools or having schools in serious need of repairs?
The Honourable Premier.
Mr. Speaker, I thank the Honourable for the question. The issues around the Bridgetown schools have been ongoing. If you go back to around 2000, when that party was in power, the school board of the day identified challenges with the Bridgetown Elementary School. Mr. Speaker, we went through. If they don't, you'll get an opportunity to reply, I'm sure. So, Mr. Speaker, Mr. Speaker, the school board across the province went out into communities, to their credit, Mr. Speaker, talking about the declining population in the community of Bridgetown and surrounding area. They laid out a series of options. One of them was a P to 8, one of them was a P to 12. They worked with the community. The community chose, Mr. Speaker, that they wanted a single school, a P to 12, in the community of Bridgetown. They went through, and the board had put that on. He's very right. There was an issue for a renovation. Mr. Speaker, that renovation, in order to convert the high school from 1956 to be able to accompany those young 4-year-olds coming in, Mr. Speaker, would have been approximately about $20 million. The new build was a bit more, Mr. Speaker. The school board at that time recognized it was better value for taxpayers to build a new school. It's that simple, Mr. Speaker. We are not pitting kids against kids, Mr. Speaker. It is that member should know better than that.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, my question is for the Acting Minister of Fisheries and Agriculture. Canada has made an international commitment to protect 10% of its coastal marine areas by 2020. It has also set a short-term target of 5% protection by 2017. Yet, Mr. Speaker, with this deadline just a year away, Canada has only protected just under 1%. With only a few provinces being able to help the federal government, the scramble to reach this target could have a significant impact on Nova Scotia in the fishing industry. So I'd like to ask the acting minister, who is in the government taking the lead on this issue of marine protected areas?
The Honourable Acting Minister of Fisheries and Aquaculture.
Thank you, Mr. Speaker, and I thank the Honourable Member for that question. Obviously, it's not a question I certainly have the answer for, but I will endeavour to make sure that he gets the answer for that question, and he'll have it next as soon as the Minister returns from his fisheries trip. Thank you.
The Honourable House Leader in the House for the New Democratic Party.
Well, thank you very much, Mr. Speaker. And a news flash, my understanding is the Minister of Environment has the lead on this particular topic, and she walked away from the table last time she was with her counterparts. Mr. Speaker, fishers are concerned that given the short time left to meet this target, decisions may be made in haste that could unduly affect the fishing industry. As fishers know, if you are not at the table, there's a good chance that you are on the menu. So I'd like to ask the Minister, how is she working with fishers to ensure that their interests are representations in negotiations about marine protected areas?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. And first of all, I want to thank our fabulous Minister of Fisheries and Oceans for the work that he's doing. Nova Scotia's success story in dealing...
Order, please. The Honourable Minister of the Environment has the floor.
Nova Scotia's success story in our fisheries export has certainly been legendary. First time this has ever happened in our province. So I will endeavour to make sure that the Minister has the questions and responds as quickly as possible. Thank you.
The Honourable Member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. And Mr. Speaker, my question through you is to the Minister responsible for EMO. On Wednesday, the Infrastructure Minister admitted it has been a struggle for 17 homeowners who lost their home and everything in them during the Thanksgiving flood. A spokesperson for these homeowners says that support for these families from the province has been unclear and slow. Families who are living in hotels paid by donations are being told that they have to find alternate accommodations. And, Mr. Speaker, I'll table that information. So my question to the Minister is, will the Minister provide some clarity for the victims and tell them when they will receive funding to begin rebuilding their lives?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker, and I do appreciate the question, and I appreciate the distress that those folks have been in over the course of recent weeks. All of us can imagine the impact to our families had any of that devastation happen to our homes, which is why we are expediting this process as quickly as possible. Mr. Speaker, we have sent additional resources into that area to assist with the inspections and appraisals. We have eliminated the $1,000 deduction from the government-funded disaster relief program to assist people. We've upped the cap from $80,000 to $200,000 to help these people move forward with rebuilding their lives, Mr. Speaker. And resources specifically right now are being focused on those homeowners that have been displaced, and no one should be under any pressure to move out of any hotel. All emergent issues should be taken care of, Mr. Speaker.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much. And I will say to the Minister that there are a lot of people that have been working very hard on this file, and it is to the credit of those individuals that things are moving the way they are, and we're appreciative of that. But the Minister and the government has said time is of the essence, and we all agree with that. Winter is coming and Christmas is coming. Yet hasn't told anybody how they can expect funding from the government for their new homes. Now, Mr. Speaker, 17 families have lost everything, and they are uncertain about their future and how and when will they get back on their feet. So, Mr. Speaker, the question is very simple. Will the Minister commit to contacting the affected families and explaining the government's plan for them, and if so, when?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. We have sent additional resources into that area to specifically help those people in that situation, and I, of course, would be pleased to reach out personally and chat with those homeowners. I do hope to be up in Cape Breton myself, and would appreciate the opportunity to meet them on site. We have had 250 applications come in to the Department for disaster relief. That speaks to the effort that is being put in to expedite this process. I wish I could give the member in this House a specific timeline on when dollars will start flowing to the individuals. That is very difficult because it is complex. It involves paperwork from insurance companies, and of course a lot of paperwork that citizens have to do, but we do have resources in place to help those individuals. We have helplines available for people that require additional assistance, Mr. Speaker, and if there's anything else that we can do to assist that member and those folks, please know that the province will be there.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. My question is to the Minister of Health. Mr. Speaker, a few weeks ago, the Minister announced that the province would hire 22 nurse practitioners and family practice nurses to help ease the pressure on the healthcare system. My question to the Minister is, when will these people be hired to help ease the need for primary health care in the province and in Cape Breton, and where will they be situated?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I know a number of communities were identified where some of the 13 nurse practitioners and the 8 or 9 family practice nurses would be heading. That plan is now continuing to be executed through hiring, and I know the Sydney area is one of those areas where NPs will join clinical practices that already exist.
The Honourable Member for Northside Westmount.
Mr. Speaker, there are at least 7 nurse practitioners in Cape Breton now that are not working as a nurse practitioner. They met with the Health Authority last week and were told there was no money to hire them. If there's no money to hire them, where's the money coming from for the 22 people they're looking for? We have people ready to jump in now, help ease the burden on the system, while we move to our so-called savior, the collaborative practices, in 5 to 10 years. So, Mr. Speaker, will the Minister commit to meeting with this young group and making sure that the money announced a few weeks ago will be used to help hire these medical professionals?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. One of the important areas that we know has to have the best planning is where these nurse practitioners, family practice nurses, can in fact be best placed to look after the highest number of people needing primary care, and I know that process is well underway, and I certainly can provide more details as the planning goes along.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. This government was elected on a promise of a doctor for every Nova Scotian. A promise I noticed that they have recently, Mr. Speaker, removed from their website. 3 years after being elected, there are still over 100,000 people without a family doctor, and this is particularly concerning for pregnant women who need access to prenatal care. Ongoing prenatal care reduces the risks of complications and increases infant health, Mr. Speaker. So does the minister know of the 100,000 or so Nova Scotians without a doctor? How many are pregnant women who are in need of prenatal care?
Hear, hear. Honourable Minister of Health.
Thank you very much, Mr. Speaker. While I wouldn't know the exact number of people who, in fact, require prenatal care, what I do know is that in our communities across Nova Scotia, we do all we can, both through current family doctors, nurse practitioners, midwives, to make sure that, in fact, the best care is available to those who are seeking that kind of preparation for birth, and a plan for follow-up care is well in place.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, those concerned is because many of them are concerned because of the need to call a 1-800 number, Mr. Speaker. And I know the government just recently announced a new number to call. The previous number took sometimes 4 to 6 months for someone to return a phone call to someone who needs a family physician, Mr. Speaker. Midwives and midwifery services could help ease the concern for many Nova Scotian women who are pregnant and need of prenatal care. But since taking office, there hasn't been any expansion of midwifery services across the province, Mr. Speaker. There's 3 areas in the province you can get that. So I'd like to ask the minister, when will the government expand the use of midwifery services in Nova Scotia? It could help many Nova Scotians, Mr. Speaker.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. The member opposite is right. Midwifery is a very valuable service. In fact, that provides...
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to government business. The Honourable Deputy Government House Leader.
Thank you, Mr. Speaker. First, if I may beg leave to make an introduction.
Permission granted.
Thank you, Mr. Speaker. I'd like to draw the members' attention to the East Gallery, where we have Scott Lockhart. Scott is a native Spring Hiller who lives in that community and does business. He was instrumental in the federal campaign to have Bill Casey elected as the Member of Parliament for Cumberland and Colchester, and I know he's also going to be instrumental in a formidable campaign to have a Liberal member elected there in the next provincial election. So I would ask that all members of the House give Scott a warm welcome.
The Honourable Deputy Government House Leader.
Thank you, Mr. Speaker. Please call government business public bills for second reading.
We'll now call public bills for second reading.
Please call bill number 6.